sincerely apologize for that technical glitch we've had to deal with, but let's continue with the news here on Joy News Prime. And he was once an active sportsman who played football, taekwondo, among others. But 15-year-old Charles Ni alias Chase can no longer participate in these activities because of a bone disorder. His family fear he may be unable to walk again if help doesn't come for him to undergo surgery, which has been hanging for almost 3 years. Meet 15-year-old Charles, a boy whose interest and active participation in sporting activities while growing up has faded because of a medical condition doctors describe as achondroplasia, a bone growth disorder that causes disproportionate dwarfism.
That's not a problem. Okay. And the pain is right here or above? Only.
Charles's mother, Sophie, says she discovered a little lump on his back shortly after birth.
We realized that he was almost 10 years. We had not even raised, how do you call it, once for the
surgery
operation. And we came, and then the doctors realized that he was still not strong enough to bear the major surgery on his body.
At 15, Charles has to quit all forms of sports because he easily runs out of breath. He is in pain. Years after being diagnosed by Focus Hospital, little Charles is yet to undergo corrective surgery.
He has a condition called achondroplasia. And achondroplasia is probably the most common form of people with short stature or dwarfism. It's autosomal dominant, which means that it is inherited. And when it happens, there's a very characteristic feature of the short limbs, upper and lower extremities. But they normally have the same length of trunk. Right. The trunk, for some reason, continues to maintain its height, but the growth plates are affected, causing the spine to bend.
Chief Executive Officer of Focus Orthopedic Hospital, Professor Oheniba Boacheji, says his condition requires urgent attention.
Some of these patients also have narrow spinal canals. We call it congenital spinal stenosis. Their spinal canals are short, so they get very tight when they're walking, and they can get pain in their legs. They can affect their bowel and bladder function. And they can also have very narrow foramen magnum, which is this.
But since Charles was diagnosed, his family has been unable to raise the required 65,000 cedis for the corrective procedure. Though his class and schoolmates have been warned about involving him in strenuous activities, little Charles says he wants to live like all his other mates. His family has been able to mobilize some amount of money, but it's not enough to have the procedures started.
In my office, I went to see some of the the big men. Oh, we'll do it. Oh, bring me the letters. Oh, bring me the accounts. Or when you start calling them once, twice, thrice, they see your number, then they block you.
Doctors say if Charles does not have this problem corrected, he may be rendered permanently incapable of moving. His mother fears the worst may happen if help does not come urgently. She does not want to lose one of her 2 children. And Charles would return to life again, and his dream of becoming a real estate developer could be a reality.
Okay, it doesn't hurt.